This video was supported by the Australian Government through its Wildlife Rescue and Rehabilitation Initiative and the Foundation for National Parks and Wildlife. Hi, I'm Dr. Bree Talbot, Foundation Vet for the Byron Bay Wildlife Hospital. And today helping me we have vet nurse Kat. And we're going to be talking about how you can examine and treat snakes in your practice. Now, it's very important when you do have a snake come into your practice that you have it correctly identified before you handle it. If you're not sure, please contact your local wildlife carer or rehab facilitation and they can help you. So we have identified this snake as a coastal carpet python. We're going to be using our assistant to get it out so that the vet can do the examination. So you can see Kat here, she's gently put her hand in. She hasn't gone in quickly, but she's gone in with purpose, and so that she knows what she goes in, she's going to actually grab the snake. You want to put your hand behind the head and then gently grasp around the back of the skull. You can see Kat is holding it firmly, but not too tight that it can't breathe and it's not feeling like it's struggling, but it can't turn around to bite her. When you're doing your physical exam on a snake, remember they're a tube, so everything is going to be elongated, but generally you divide a snake into thirds and you'll have certain body organs in each third. So with our heart, for instance, it's going to be in the cranial third. And if you put them on their back, you can actually quite often see it pulsating and see it beating. Then the mid third is going to be your gastrointestinal system and your lungs. And then in the caudal third, you're going to have your kidneys, the rest of your gastrointestinal tract, and your reproductive organs as well. Now, just feel along the body. You want to feel if there's anything attached to the scales, like ticks. You want to feel for muscle tone to see if there's any spinal trauma or any sort of changes to that muscle tone, which could indicate an inability to grasp, and that's maybe why they're on the ground. So we can see here, this snake has a tick, which is not uncommon to find. And then you're also going to feel for any lumps or bumps in the coelomic cavity. And so our snake actually does have a mass located in its caudal abdomen here, and so you then want to write in your notes at a specific length of where you think that mass is, and the most common way to identify that is a snout vent length percentage. And then last but not least, we want to get down to the vent or the cloaca, and you want to check that it's nice and clean. There's nothing prolapsed, there's nothing sticking out, no infections. Most clinics will have a paddle pop stick, and you can use these to have a look into a snake's mouth. Remember, only do this on a non-venomous snake. And you just want to slowly put the paddle pop stick into their mouth. Now remember, these guys have very little fragile teeth and we don't want to break them. Just gently put it in and then leave their mouth open. Once you start to put the paddle pop stick in, they generally get a little bit annoyed at that and they'll open their mouth quite wide for you, so it works to your advantage. And so what you want to look for in their mouth is any bleeding, any bruising, any discharge sitting at the glottis, and anything at the back of the oral cavity. Once you have done your thorough physical exam of your snake and you've noted down any abnormalities, the next thing you need to do is weigh it. We put our box on, we tear it, and then we can put the snake in. The easiest place to get blood from a snake is the ventral coccygeal vein. Get your assistant to try and hold the snake nice and straight for you. Then you hold the distal part of the tail in your hand so you can control where it moves. You're going to find the midline of the tail. You're going to go in between the scales and underneath to get underneath into the muscle. So once you're underneath the scale, you're then going to lift your needles to a 45-degree angle, and you're going to go down till you hit the spine. A little bit of negative pressure on the syringe, and then you're going to pull back until you try and find that vessel. A little trick that I find quite helpful is to rotate the needle on its axis, because you might just be sitting right next to the blood vessel, but the bevel of the needle's facing the other direction. There we go. So you can see it's quite slow, but it's a nice steady stream. So you want to get enough blood to be able to do a PCV, a TPP, a blood smear, and depending on what illnesses you think might be occurring, enough for a biochemistry panel. We're mocking up an X-ray plate to show you how to position an animal. We want to do a DV and a lateral, and you want to do it in sections so that you don't miss anything. So we've got Kat here holding the snake out. We're pretending that she is gowned up. You want to try and get the body as straight as possible because we want to make sure that we can see the spine properly and the ribs, because a lot of times when these guys come in, they do have rib fractures and they can actually get spinal luxations. So you want to try and get the animal as straight as possible. Set them right in the middle of the table. Remember to collimate, and then just go along in your sections like you would with a dog and cat. Once you've done your DVs, then you do your laterals. Get the snake on the side, and just remember to put your marker somewhere where you're going to remember what end of the snake you've been at, so that you can have a continuous image. Once you've done your diagnostic workup and you've got a diagnosis, you might need to give the snake some medications or fluids for an intramuscular injection. You're going to find the spine, and then you want to go for the epaxial muscles on either side. So you want to feel to make sure you can feel it. If you go too far to the side here, you'll actually go into the coelomic cavity. We don't want to go in there. So feel for your spine and then just go over to the side. Make sure you can feel the nice meaty part, and that's where you want to go. Prep the area as normal. Hold the section that you want to actually give the injection, because they will actually move because it can be quite painful. Bevel up, normal. We're going to go in between scales, never go through a scale in a reptile. Underneath a scale, feel as though you're in the muscle, so you don't have to push. Depending on the snake, you don't actually have to go all the way in. Pull back on the needle to make sure that you're not in a blood vessel or in the coelomic cavity, and you don't want to get gastrointestinal contents back. And once you're happy, push the needle in and pull the needle out. Nice and simple. There are two ways we can give fluids into a snake. We can go subcutaneously, or we can go intraperitoneal. For this snake, we're going to be giving that subcutaneously because it's only a small amount. And it's the same principle, but we're not going to go as deep as we would for an intramuscular injection. Prepare the area, go under the scale, but keep nice and superficial. Pull back just to make sure that you're in the right space, and then you're going to give the fluids. Now, one of the signs that lets you know you're in a good spot is if the fluid starts traveling up in a tube underneath the skin, you're in the right plane. When we give intracoelomic fluids, I do tend to go further down the body so that it's less likely that I hit something important like a kidney or the gastrointestinal system. So where the skin changes colour, the patterns change, is usually a good indication of where you're going to be going into the coelomic cavity. Remember, always give warm fluids to any of your wildlife patients, and that does include snakes. Between the scales, between and under, we go under the scales and then go in. Pull back to make sure you don't get any gastrointestinal contents or blood, and if you're okay, then you can give that. This is probably a safer route to give a high volume of fluids if you need to, if you've got a bigger snake. Make sure there's no bleeding or anything coming out afterwards, and then you're done. When you need to use chemical restraint or anesthesia to do any procedure with your snake, it is important to remember that they do not have a diaphragm and often require IPPV. So when you are anaesthetizing these guys, remember you're going to have to breathe for them, and that includes post-anesthetic recovery. You may need to keep the tube in longer, and you may need to use an ambu-bag to provide oxygen for them. Allowing a snake or any reptile to breathe room air with the assistance of an ambu-bag will help spontaneous breathing return much quicker. If you keep them on oxygen for too long, their respiratory drive will not kick in, and you'll actually have a snake that remains under anesthesia for a longer period of time than you require. Once you have finished your workup with your snake and given it the appropriate medication and treatment, it's now time to put them back in their house. Once you get used to handling snakes and you learn their behaviour, you will then find which technique works better for you and the snake. So with this snake, it's quite a calm snake, so we can actually put the body in and then we can let the head go last. But say a snake that really wants to get away from you and is in a bag, it probably would be better to open the bag and let the head go in first, because it wants to get away from you and wants to go somewhere nice and dark and quiet, and that would probably work better for a bag situation. So she's being nice and calm, deliberate in what she's doing, making sure she's happy before she lets the head go, and she's just gentle, and he's just going to sit there. We are very grateful to the Foundation for National Parks and Wildlife for producing this video. If you have any questions regarding treating our Australian native animals, please do not hesitate to contact the Byron Bay Wildlife Hospital at www.byronbaywildlifehospital.org.